Hey guys, let's talk about what hip impingement is because I know it can be a little bit scary and a little bit hard to understand what's even going on with your hip. And so I just want to walk you through what exactly is happening if you've either been told you have impingement or a labral tear. So here is your hip joint. This is if we're looking at it from the front. And there's two main bones in your hip joint. You have the femur, which is like the thigh bone, and then you also have the pelvis. And so what makes up the hip joint itself is the head of the femur with what's called the acetabulum or the socket that's on the pelvis. In between those two surfaces, you have what's known as your labrum, which is the cartilage that kind of cushions and protects the joint and also deepens that socket a little bit so the head of the femur fits really nicely and securely in there. Now, this is a ball and socket joint, which means it can move in a lot of different directions, which is awesome. But it also means that it requires some pretty good mechanics of things going on here so that you don't end up with compression where you don't want it or pain where you don't want it, or things like impingement or a labral tear. So when we have what's known as hip impingement, there's sort of two different things that go in that. There is a functional impingement and then there's a structural impingement. Now let's talk about the structure side first, because this is what often gets diagnosed on your MRI or your X-ray. And so the structure is we can either have what's known as a cam impingement or a pincer impingement, or you can have a little combo of both. And basically, what that means is that there's either extra bony growth on the head of the femur here, so kind of like the head and the neck of the femur, there's extra bone that fills in and kind of changes the shape of it, or there's extra bony growth on the ring of that or the socket or the acetabulum. And so, what ends up happening when we have that extra bony growth is now when I go to move, the joint can't, it kind of, we get compression too early in the range of motion or where we don't want it. And then it creates the pain that you feel. So it's not gliding quite as it should with movement in the socket. Here's the thing though about structural impingements. We know that a lot of people have a structural deformity, if you want to call it that, because everybody's joints are and bones are shaped a little bit differently. No two hip joints really look the same. You know, the angle of the head of the femur can be a little different, and how much bony growth you have on the head of the femur versus the acetabulum, like it's just so different for everybody. And a lot of people, they'll do x-rays and MRIs and find that like 60 to 70% of people still have something structurally going on, but they don't have any symptoms. So just because you do have a structural impingement doesn't always mean that you have to have surgery. And it may not even really be telling you what the problem is. Now, what we do know is that people who have a structural impingement usually also have a problem with how they're moving, which is the functional impingement. So you can have a structural impingement by itself, you can have a movement or functional impingement by itself, or you can have a little bit of combination of both. But for a lot of people, especially if you've been told that, hey, I had my image and my hip is completely fine, but I still have all this pain, like what the heck's going on? Well, it very likely is the way that you're moving. This also would be really true for people who have had the surgery and they've had the bone shaved down and they're still having pain. Again, very likely what you're actually experiencing is a problem with how you're moving and a functional impingement. So let's talk about what that means. So basically, a functional impingement is when the head of the femur isn't gliding properly in the socket, not because of structure, but because of how the muscles are coordinating the movement. So what is supposed to happen when we flex our hip joint? So I'm going to use flexion as an example. So when I pull my knee closer to my chest, the head of this femur has to stay centered in the socket. And sometimes it doesn't stay centered. Sometimes what happens is it actually pulls a little bit too far forward. And I don't want to give the illusion that it's coming out of the socket. It is not coming out of alignment. There's just too much forward pressure on it. It doesn't glide properly. So there's too much forward pressure. And now when I flex, I get a lot of contact between these two bones on the front part of the joint. And that's that classic pinch or catch or popping that you might feel, the pressure, the pain right in that groin area, that deep joint. It's often because the head of the femur is contacting the front of the socket there, the acetabulum, either too early in the movement or it's just contacting it and it's causing irritation and pain. Sometimes you still have full motion, but it hurts when it happens. So what's supposed to happen so that it clears that space is the head of the femur actually has to glide down and back into that socket just a little bit. I'm going to show you with my hands because it's a little easier to see. So when I flex, the head of the femur has to glide down and back into the socket so that I can clear that space and it doesn't compress too early. Sometimes what happens with a functional impingement is, again, the head of the femur doesn't glide, it rides forward, and I get the compression on the front of the joint and that classic pinch or the pain that you feel. So we want to retrain that little bit of gliding movement. And that's not easy to do because you can't really feel it happening, but it is super possible. What does it? It's all the muscles around the joint. And so this is where we then have to look at, well, why is that happening for you? And it might be different for everybody. For some people, it's because the deep hip stabilizers and the muscles sort of on the backside of the joint aren't doing their job at holding it stable. Sometimes they're too tight and too tense, and so it can't glide back because it's kind of restricting mobility, or we're lacking internal or external rotation. Sometimes it's an issue with the hip flexor. Maybe my hip flexor isn't strong enough. And so I call into some of these other muscles on the front side of the joint, which ultimately pull the head of that femur too far forward and give it that compression. But if we can strengthen hip flexor, it allows it to stay seated properly in the socket. So there's a lot of different possibilities of why it is that you might be experiencing that functional impingement. And you do have to figure out, well, what is your imbalance to know what exercises should you do to correct it. But at the very base of what we're looking at, it's teaching you when you have an impingement, how do I keep the head of the femur centered in the socket? Now, again, if you're somebody who has had surgery already and you're wondering, why the heck am I still in pain? Or you're wondering, should I have surgery? Is that even going to solve my problem? What I want to make sure that you have a really good understanding of is it might. However, unless you learn how to move with good patterns, it's not going to solve the problem. Surgery will solve the structure part of the impingement, but it will not change how you move. And you must learn how to move no matter what. Because if you've had a structural problem for a while, you've probably compensated and changed the way you're moving, which is contributing to more of that functional impingement. And so unless you do something to address that piece of it, it's not going to solve the issue. So it's super important that we learn how to move with good alignment. And that also means you needing to understand which areas in my body are not allowing that to happen. And that's where you want to target the exercises too, because it will be a little different for everybody. There's certainly some common patterns of things that we see, but ultimately it has to be what works for your body. Last thing I'll mention is the idea of labral tear, and it kind of all feeds into the same things we just talked about, but what actually is the labral tear? So on the inside ring of the socket here, this is where your labrum is. And again, it's that cartilage, it deepens the socket, it helps create some structure and stability. And so what happens when it tears is it almost like turns into like a little hangnail in there. And so the hangnail gets caught, right? The hangnail hurts when you rub on it. So if every time I move my joint, it's catching on that little hangnail, it's going to create some inflammation and some irritation. And so sometimes having the surgery to shave it down will solve that problem. But just because you have a labral tear, it doesn't always mean that that's where your pain is coming from. So of course, it circles back to, are you moving your joint in the right position, in good patterns? Is the head of the femur able to glide back into the socket? And if it is, that ultimately should be what solves the pain that you're having from whether it's coming from the labral tear or how you're moving. What ends up happening with the tear, it goes back to the idea of the impingement, is when I'm flexing my hip joint, if the head of the femur is coming too far forward in the socket, again, it's going to contact at the front here. And it just so happens that this is where the labrum is the thinnest and the most exposed. So you can imagine that repetitive contact hitting here on the front, it's going to wear down on that labrum. And that's essentially what often causes the impingement or the tear. I'm sorry. Many people will argue, well, my bone wasn't shaped right, so I had to have the bone changed so that I could move, so it wasn't putting pressure on the labral tear. And for some people, that is the case. But for most people, I would say it's not. For most people, they have to learn how to move so it takes the pressure off the front of the socket. And so that's ultimately how we manage. That's what's going on in your hip, and that's how we manage and deal with what's actually physically happening. Hopefully that makes sense. If you ever have any questions, I'll go ahead and drop my info below. You can reach out to me at any point, and I'm happy to answer your questions. I absolutely love helping people with this issue because I just don't think there's enough help out there for you guys. So that is what I'm here for. So check out some of these resources below and let me know if you have any questions, and we'll talk real soon.